Hi, it's me, Dr. Daniel, and I wanted to create a video talking about a functional medicine approach to anxiety, depression, and related mood disorders or brain-based dysfunctions. This is a very big topic because so many people suffer from depression, from anxiety, from a number of different types of panic attacks, as well as what we could classify as brain-based disorders, dysfunctions that seem to be related to the brain. Now, mental illness and brain-based disorders have become increasingly common in our modern world, especially over the last few decades. And then if we're talking about within the context of the COVID-19 pandemic, this was an issue before the pandemic. Of course, we've had robust mental health challenges even before, but now post-pandemic, we're finding that these problems have actually increased. Now, during the current pandemic, effects from social distancing and isolation combined with increases in stress and anxiety have resulted in both short and long-term mental health consequences, unfortunately. Now, according to the National Alliance on Mental Illness, 1 in 5 American adults currently experiences mental illness, and 17% of US adolescents have a mental illness, which is just shocking. Now, before diving into this in-depth discussion on a functional medicine approach to mood and brain-based disorders, let's briefly discuss some of the most common mental illnesses that people experience. Number one at the top of the list is going to be depression. More than 19 million US adults, or 8% of the population, have experienced a depressive episode over the past year, making depression one of the most common mental illnesses. Symptoms of depression can vary from person to person, but most commonly, this is going to include things like changes in your sleep habits, changes in appetite, a lack of energy, a lack of interest or motivation in activities that maybe before somebody was really interested in, feelings of hopelessness or guilty thoughts. Physical aches and pains can also be an indication of depression. And if left untreated, depression begins to significantly impact our physical health, our functionality, and even our relationships with people around us. Now, while some people experience just one depressive episode in their lives, more often than not, depression actually recurs over and over. Another important fact is that women are twice as likely as men to experience major depression. Women also tend to experience types of depression that are related to fertility hormones. And this could include premenstrual dysphoric disorder, postpartum depression, and then postmenopausal depression. The conventional treatment for depression, of course, usually includes the prescription drugs known as SSRIs, or selective serotonin reuptake inhibitors. However, research indicates that the clinical response to SSRIs is actually inadequate at best, with only 40 to 60% of people experiencing symptomatic relief and a mere 30 to 45% experiencing remission. SSRIs and other antidepressants also have side effects that can in turn actually contribute to depression. And this includes things like weight gain, unintended weight gain, right? Sexual dysfunctions, depletion of beneficial bacteria in our gut, which then in turn contributes to the problem as well. And then withdrawal symptoms upon discontinuation. And this is something that a lot of people they're not informed, is they get put on these medications. Maybe they start to feel better, but they're stuck with them. They can't ever come off of them. And the longer that they're on them, of course, there's more dysfunctions that start to happen. Now, more concerning is the fact that 25% of people on SSRIs have taken them for over a decade, and there are no SSRI safety studies that have lasted for more than 2 years. So we only have data on people taking these for 2 years. We don't know the long-term effects. And again, 25%, 1 out of every 4 people taking these compounds are now taking them over a decade. Another condition is anxiety. Anxiety disorders are the most common mental illness in the US, impacting more than 40 million adults ages 18 and older. People with an anxiety disorder are 3 to 5 times more likely to go to the doctor and 6 times more likely to be hospitalized for psychiatric disorders than those who do not suffer from anxiety. Now, the vast majority of people diagnosed with an anxiety disorder will, of course, be prescribed SSRIs as well. And in addition, another common prescription includes benzodiazepines, also known as benzos, which in turn have their own side effects. Of course, every drug has a side effect, including cognitive dysfunction, sexual dysfunction, and increased anxiety and depression. Then we have things like bipolar disorder, which is definitely a much more serious condition, also known as manic depressive disorder. And this is usually characterized by dramatic highs, where somebody's just feeling like on the top of the world, with dramatic lows in their mood and their energy and their activity levels that go on to influence an individual's ability to be able to function within the world. And it's estimated that 2.8% of American adults have experienced bipolar disorder in the past year, and 89% of people with bipolar disorder are seriously impaired, where they're unable to carry out activities of daily living. We also have a lot of post-traumatic stress disorder, PTSD, and this could be coming from adverse childhood events, so things that impact us as kids. It could be something as an adult, such as like a very severe car accident, separation from a loved one, or loss of a loved one, even things like the pandemic itself, right? The stress of it all. Of course, PTSD affects people from all walks of life, including former soldiers, victims of sexual abuse, and people who were bullied as children. PTSD is generally the result of acute trauma. Again, this could be, combat trauma, witnessing a death, natural disasters, like I said, severe car crashes or injuries. And then, of course, you have adverse child events, things that happen to us as children. Then you have eating disorders. Eating disorders encompass an array of food and body image related disorders. And this includes things like anorexia nervosa, atypical anorexia, bulimia, binge eating, purging disorder, and night eating syndrome. Now, let's take a minute to talk about mental illness theories. When it comes to asking why mental health issues occur, there are two leading theories that we can talk about. The first one being the evolutionary mismatch theory, and then the second being the pathogen host theory. Now, the evolutionary mismatch theory, I've spoken and written about this extensively regarding our modern health and the evolutionary mismatches that contribute to chronic disease. In other words, today, how we're living, the environment that we're living in, the foods that we're being exposed to, everything, every part of our life really today is completely different than what it was, 50 years ago, 100 years ago, way more different than it was a couple of thousand years ago when our genetics were actually selected. And so today, even though our genetics are not different, we are living in this environment that is just genetically incongruent. So there's an evolutionary mismatch with how we're living, and that itself could be a big form of stress contributing to problems. We also have mental illness that could be related to, like I said, what's called a pathogen host theory. So mental illness as a byproduct of infections and inflammation. And this is another theory as to what drives mental illness. And it's basically inflammation as a cause of depression and other mental health disorders as a side effect due to infections. Now, according to the pathogen host theory, basically when our ancestors developed an acute infection, their bodies launched an inflammatory response to combat pathogens. And the unintended consequences of inflammation was really depression. And this served to slow them down, to allow them to recover. However, as human civilization grew and our immune systems changed, this once adaptive mechanism really ceased to be useful. And today, the experience of chronic inflammation and subsequently chronic mental illnesses occur because of it. Now, what are some underlying causes of anxiety, depression, and mood disorders? Well, taking into account what I just discussed, both of those theories of mental illness, we can begin to create a clinical hierarchy of underlying causes in our mental illness. And the major underlying causes of anxiety, depression, and other mood disorders would include, number one, in my opinion, at the top of the list, infections and immune dysregulation. If there is something that you could find a common ground with all forms of brain-based disorders, depression, anxiety, all of these things, it's going to be infections and immune dysregulation. Number two, the standard American diet. Quite frankly, people just don't eat enough of the right types of foods, and there's just massive amounts of nutrient deficiencies that then result in our bodies not being able to function properly. Literally, the cells are starving because they don't have adequate nutrient intake. We also have blood sugar dysregulation, sedentary lifestyles, impaired neurogenesis, not creating enough connections within our brain. There could be gut-brain communication problems, circadian rhythm disruption, imbalances in our sleep patterns, imbalances in light-dark cues, trauma, right? Trauma in itself could be a problem. And then, of course, we're experiencing massive amounts of loneliness. And then there are other environmental triggers. This would be things like the amount of chemicals that have been released into our environment. These are chemicals coming in the forms of cosmetic products, consumer products, household cleaners, detergents, deodorant. You got to be very careful with these products that we're using, because these products contain a lot of chemicals. Those chemicals then have abnormal effects within our body. Now, each and every one of those we can talk about. And if we start with infection and immune dysregulation, again, most people think about infections as acute or immediate, right? Like you get sick and you get fever. Many people don't realize that you can have chronic low-grade stealth infections, viral infections, bacterial infections, fungal infections, all of these chronic stealth infections that ultimately create low-grade amounts of inflammation. This inflammation can travel up to the brain, create neural inflammation, therefore creating this problem that we describe as depression, anxiety, and whatnot. So again, these are all the things that really, if you're suffering from some of these brain-based disorders, brain-based dysfunctions, these are things that we really need to be thinking about. As final thoughts to this video, and as discussed already, there's obviously more to mental health and mood disturbance than chemical imbalances that most people think about, right? Such as low serotonin or low dopamine. Even if you do have low serotonin or dopamine, the question should be, what is driving that down? What is causing that? And then more important, what are the steps needed to correct that? Now, although this doesn't mean that chemical imbalance is not a factor in depression or mental health disorders, it does suggest that it's not the only one. An increasing body of evidence, like I've just discussed, suggests that inflammation may be the underlying issue in many of these cases. And people who suffer from mental health disorders all have the cardinal features of inflammation, including reduced levels of anti-inflammatory chemicals. So when you get the right type of testing, you're able to really pick up on these things. And then in many cases, I find that there's really high levels of pro-inflammatory chemicals in their blood. And when inflammatory chemicals are administered to healthy people, or I'm sorry, when anti-inflammatory chemicals are administered, we find that a lot of times depression starts to go away, which is pretty interesting. Finally, major depression is associated with a range of changes in the brain that promote inflammation itself. So assessing for the cause of inflammation, the cause of your nutrient imbalances, and even gut dysfunctions, gut health should all be considered if you're somebody who's struggling with mental health issues. So contrary to what conventional medicine has led us to believe, mental illness is not a life sentence. And with the identification of critical underlying causes and the implementation of functional medicine-based interventions, it is absolutely entirely possible for you to improve your mental health and your overall quality of life. I hope this message really resonates with you, and I hope you understand the information that I'm trying to share. If you have any questions, certainly feel free to reach out.